Good morning. I'm Dr. Steve Grinstead. Have you ever known anyone suffering with chronic pain? They might have had problems with their medication, they might have had some depression, sleep disorder, anxiety, and you threw up your hands because you didn't know which way to support them? Well, I want to invite you to join me so you can learn how to walk that tightrope of pain management and addiction. On April 21st to the 23rd this year in Sacramento, California, I am offering my addiction-free pain management certification school. Now, this is a very interactive and experiential workshop. It's 20 hours. It's designed to help you develop a strategic plan to helping this particular population. You know, it's in our office space here in beautiful Sacramento. This is going to be the last time I offer this workshop here in Sacramento. In the future, this fall, it's going to be in Southern California. So if you're in Northern California, or if you prefer to come to Sacramento, this will be the last time for this particular school. You know, I've been working with people with chronic pain and coexisting disorders, including addiction, since 1984. But in 1996, I decided to start developing a model. I had a mentor, Terry Gorski, who let me use a lot of his resources, and I developed this started of the addiction-free pain management system. Now, to do this, I wanted to go out and do some research. I wanted to find out what happened with this population when they sought help. You know, somebody who was living with chronic pain and had addiction. Well, it was very troubling because although I had access to 4 different libraries where I was teaching, you know, UC Santa Cruz, UC Berkeley, Santa Clara University, and Stanford Medical School, it was very challenging. And remember, this was pre-Google, so it was even more challenging to do research. But I endeavored. I went in there, I did as much as I could, and I started getting frustrated. Then I started getting very frustrated because I couldn't find anything. This led me to the decision that I needed to go out and do my own research. And as a result of that research, I discovered what I'm calling the addiction pain syndrome. To explain that, let me talk about, first of all, when people develop an addictive disorder, they have things that go wrong in their life, biologically, psychologically, socially, and spiritually. They have a lot of symptoms or problems. People who are living with chronic pain and develop a pain disorder have a similar but different set of bio, psycho, social, spiritual problems. And it impacts their life, their ability to function, their ability to be healthy, to work, to have relationships, to socialize, to interact, to be spiritual. All this gets impacted. Now, what happens is when the person has both, it's not 1 plus 1 equals 2. At this point, there's a synergistic effect that I called the addiction pain syndrome zone. So this is the zone where symptoms get amplified. And that's why traditional treatments don't work very well. If you look at the blue zone, the addictive disorder zone, if somebody who has both conditions goes into an addiction treatment program, they get 1/3 of the problem dealt with. Now let's say instead that person went into a pain clinic. Now they're dealing with a different third of the problem. Now over the years, both addiction medicine and pain medicine have gotten a lot better at cross-referring, and that's been better because then they're dealing with 2/3 of the problem. But it's a synergistic problem and it needs a synergistic solution. And then let's talk about what gets in the way of having successful outcomes. First of all, it's us, judgmental healthcare providers. You know, and I cannot tell you how many people have come in and say, Steve, they're not taking me serious. They say my pain can't be that bad. My x-rays, my MRIs, my CAT scans aren't that bad, so I can't be hurting that bad. Then, you know, they're telling me it's all in my head. Now, with a lot of the workers' comp population I deal with, they're guilty until proven innocent. And there's a blame the victim mentality about that. And then there's the shaming and blaming. You're just drug seeking, you're med seeking. So those all get in the way of effective treatment. Then there's family system problems. How'd you like to have this family? You know, the two major problems are enabling, doing something for somebody they should and could be doing for themselves. Family members and friends of people with chronic pain also become hopeless and helpless, and they don't know how, and eventually though they get burnt out or resentful, so they go from codependent to counterdependent. And it's really important. One of the indicators for successful outcomes is strong family and social support. So not just the pain patient needs to be helped, but the whole family system needs to be helped. But you know, sometimes it's the patients who get in their own way. You know, picture that big boulder right on the path to a healthy life. And it's very, very frustrating for the person because they just don't know how to get around that obstacle. Some of the ways these obstacles show up is a lot of people get into either people pleasing or malicious compliance in order to keep their pain meds coming for them. A lot of people unfortunately get into a real chronic pain trance, hopeless, helpless state of mind. Many of them develop severe grief and loss, and they're stuck in a grieving process. A lot of them have a tremendous amount of shame and guilt because they're no longer able to do what they did before. They're not able to be a good worker, a good parent, a good student, a good child, whatever. And many people get clinically depressed, and several other co-occurring disorders, sleep, anxiety, trauma, etc. These people have a tremendous amount of resistance and psychological denial about pain management. I'm not just talking about addiction here. But then when there's a substance use disorder that plays in, that resistance and denial gets even worse. And many times people get into these power struggles with their providers. At this 20-hour experiential workshop, we're going to be doing a lot of work on how to help people move out of their own way and get out of the problem into the solution. We're going to talk a lot about grief, loss, and depression. I think that's a very important thing. So I'm going to be teaching you how to look for signs of the grieving process and develop a treatment plan that's going to give the person some hope. If you've done nothing else in your first session except plant some seeds of hope, you've done a lot. We want to move people out of that victim mindset, from being powerless to empowered. I'm always needing to dig deep on depression. A lot of people can put on a very good facade. So I want to look for it and see how bad it is. Now, if it's very severe, I'm going to be getting a consult with a psychiatrist for medication management. If it's just minor to moderate, I'm going to start with some cognitive behavioral interventions. So I'm going to talk about all this at the workshop. And then finally, the research shows for somebody with moderate to severe depression, medication by itself isn't enough. They also have to have some cognitive behavioral interventions to go with it. Now, a lot of times there's unrealistic expectations that get in the way. For example, a lot of my addiction colleagues, on one end of the spectrum, it's abstinence is the solution. Don't take nothing no matter what. Now, in some senses, that might be a good idea for somebody in recovery from an addictive disorder. However, some people with chronic pain may need to be taking something else. Then we have mental health professionals. No, psychotherapy is the solution. If we just find out why and go in and look at all those unresolved core psychological things, everything will be better. Pain management professionals, no, better chemistry through living. Medication is the solution. And then finally, for the family and friends, it's please just fix them. Fixing them is the solution. And as you can see, the real solution is a combination of all of these. So that's some of the stuff we're going to be talking about at this 20-hour experiential. So what does it take to get out of the problem and into the solution? It takes a lot of hard work. And it, I believe, takes working with the whole person. So we're going to go through how to do an assessment and see how people are operating in their biological or physiological realm. Diet, nutrition, exercise, all that, hygiene, all the good things that make a physically fit person. We're also going to be taking a look at any psychological deficits. Do they have any coexisting mental health problems? Do they have depression? Do they have anxiety? Do they have denial? Do they have resistance? What's happening in the psychological realm? How well are they functioning? Very well or very poor? And we need to design a treatment plan that's going to bring up that level of functioning. Then we want to look at how are they interacting with friends, family, and community. What I find for most of people who have chronic pain and coexisting disorders is they tend to isolate a lot, and they don't have very much social interaction with friends, family, and community. So the treatment plan needs to address that too. Now, when you put all of it together, I believe that the spiritual is the glue that holds it together. Now, I'm talking about spiritual, not religious. In this area, we're going to talk about how to assess where people are with adhering to their spiritual values, practices, and principles, and work with the whole person to see what's going on in all domains and to make sure that our treatment plan addresses it. That's why it takes a multidisciplinary team using integrated focus with a strong cognitive behavioral to have good outcomes for anybody with chronic pain. And when they have coexisting disorders, it becomes even more crucial. So come to this training because knowledge is power. You know, this saying goes back a long time. But knowledge by itself isn't enough. That's why there's going to be a lot of experiential. I'm going to tell you about it, I'm going to show you, then you're going to do it, we're going to talk about it. And you're going to learn that a little knowledge that acts is worth infinitely more than much knowledge that is idle. Now this comes from John Quincy Adams a long time ago, so it's been around for a while, but it's every bit as true today as it's ever been. So I want to help people not just get the knowledge, but to practice the tools that are going to get their patients better outcomes. So don't wait, opt in today. Now there's some information here. You can go to our website, freedomfromsufferingnow.com. When you get to our site, it's really simple. You'll see on the top of the page there's tabs. One of them says events. When you hover over that, you'll see one of the choices is live workshops and trainings. Go there, and then you go to our April addiction-free pain management training and sign up. If you don't like doing things on the net, call my office. Ellen will be more than happy to help you. My phone number, 916-575-9961. Or you can email me, drgrinstead@yahoo.com. I really want to encourage you. Space is really limited here, and when we're full, that's it for Sacramento. The next training will be next fall in Southern California. So don't miss your opportunity. Reserve your seat now. It's really possible to learn how to effectively walk that tightrope of pain management and addiction. So join me on April 21st to 23rd and learn some valuable tools. And if you're somebody who's living with chronic pain, in the past, many people come to this training who aren't working in the healthcare field, but they have chronic pain and they want to do it for their own personal benefit. They get every bit as much out of it as nurses, doctors, and therapists because they're taking it for a real personal reason. So don't hesitate, sign up now, and I look forward to seeing you on Thursday, April 21st. Registration starts between 8 and 8:30. This is an 8:30 to 5 o'clock on Thursday and Friday. On Saturday, we start at 8:30 and we'll get out by between 3 and 4 o'clock. It's going to be an awesome time, 20 hours of experiential and really goal-orientated, how to help people suffering with chronic pain and coexisting disorders get out of the problem into the solution. Please join me.